My name is Tori Montemare. I'm a graduate student at the University of Houston-Clear Lake, and I'm currently enrolled in the Advanced Sports Seminar course instructed by Dr. Bill Amonette, and today I'll be doing a critical appraisal over the article Early Targeted Heart Rate versus Placebo Stretching for Sports-Related Concussion in Adolescents. The purpose of this article was to observe aerobic exercise and placebo stretching on clinical recovery and post-concussive symptoms within a 4-week period. Researchers hypothesized that aerobic exercise would safely accelerate recovery and reduce risk of persistent post-concussive symptoms when compared with stretching exercises in adolescents after a sports-related concussion. Concussion in adolescents can be detrimental as it can affect school participation, physical activity, and quality of life. Unfortunately, an estimated 30% of adolescents with sports-related concussion will have persistent post-concussive symptoms. Participants included adolescents 13 to 18 years old presenting with 10 days of symptoms post-sports-related concussion. They were recruited from community sports med clinics associated with State University of New York at Buffalo, as well as hospital-affiliated clinics from the Children's Hospital of Philly, as well as Boston Children's Hospital. There's a hefty list of exclusion criteria from this study, as it includes a difference of 3 points or less between current and pre-injury symptoms as measured by the Post-Concussion Symptom Inventory, that's the PCSI, moderate or severe traumatic brain injury as indicated by the Glasgow Coma Scale, score of less than 13, a lesion on a CT or MRI, or focal neurological sign, consistent with intracerebral lesions, injury involving loss of consciousness for more than 30 minutes, or post-traumatic amnesia for more than 24 hours, inability to exercise because of lower extremity orthopedic injury, clinically significant vestibular or visual dysfunction, or increased cardiac risk, pre-existing conditions that prevented participation in active testing, rehabilitation, or both, currently on medication that affect autonomic function, such as attention deficit hyperactivity disorder medication or mood stabilizers, active substance abuse or dependence, unwillingness to perform intervention, and limited English proficiency. These participants were computer randomized into the aerobic group as well as the stretching group, equally associated by site and age. As we can see in Figure 1, this is the trial profile. 318 individuals were initially assessed for eligibility of the study. 127 did not meet eligibility criteria, and 68 declined to participate. That excluded 195, which left 123 to be randomized into the aerobic group as well as the stretching group. 5 were excluded after randomization due to violation of inclusion criteria, so that left 61 in the aerobic exercise group as well as 57 in the stretching group. Both participants completed the Buffalo Concussion Treadmill Test as well as the Post-Concussion Symptom Inventory at the initial evaluation during the first week, as well as once during the subsequent weeks. 61 participants were placed in the aerobic group, instructed to exercise daily at home, either walking, jogging, or stationary cycling for 20 minutes at 90% of their given heart rate. That was determined by the Buffalo Concussion Treadmill Test. They were also wearing a polar heart monitor during these exercise times daily to track that as well. They were instructed to cease exercise for the day if their symptoms had worsened at all during the exercise intervention. The stretching group was also given 57 participants. They completed daily standardized stretching and breathing exercise programs wearing heart rate monitors as well for approximately 20 minutes to kind of keep those time ranges the same between both groups. Weekly groups received either updated heart rate goals to achieve during exercise the subsequent week or an elevated stretching program to complete based on their weekly BCTT scores. As well as completing the daily exercise in both groups, they also received mobile concussion symptom surveys 3 times a day morning, afternoon, and evening, and these follow-ups also continued 2 to 4 months post-trial and post-injury. An aimed sample size of 63 participants per group was determined to detect a difference with an alpha level of 0.05 and a statistical power of 80%. However, COVID-19 did affect recruitment towards the end of the recruitment period, so they did not collect as many participants as they would have hoped to reach that 63 at least per group. Aerobic exercise had a significant effect on recovery time in this study when controlling for sex, site, and mean daily exercise time. This result also corresponded to a 48% reduction in persistent post-concussion symptom risk. You can see in Figure 2 the Kaplan-Meier survival curves stratified by intervention groups. The red's going to be representative of the aerobic exercise group, while the blue is the stretching exercise group. This is going to be representative of clinical recovery percentage across the days of the trial, which will be the 30 days or the 4 weeks. You can see the stretching exercise group had a consistent downward trend throughout the 30 days in clinical recovery percentage, while the aerobic exercise group had a visual drop in the second week between day 7 and day 14. You can also see that numerically represented in the number at risk. That's going to be at risk for persistent post-concussion symptoms. You can see at day 7, represented below, aerobic exercise group had 61 individuals, and the stretching exercise group had 54 individuals at risk. While the second week measurements, day 14, the aerobic exercise group had 30 individuals at risk compared to the 61 individuals earlier. It was cut in half throughout that week. And the stretching exercise group had 42 at the 14-day mark compared to the 54 at the 7-day mark. That did leave the aerobic exercise group having less individuals at risk from the second week throughout the remainder of the trial. Some things to consider for this study, as well as any future studies. Participants in the hospital setting did take longer to recover and had an increased frequency of symptoms at the start and throughout this study, as well as the slight difference in mean daily exercise time from the aerobic group to the stretching group. Participants in the aerobic exercise group exercised for significantly longer despite the aim to match the time durations of each. Adversely, the stretching group spent less time doing their exercises. Adherence to the program was good and no adverse effects were reported from researchers. Some limitations as well was that adolescents were the only population group evaluated, and there were no cognitive components at the beginning or end of the study as well. Overall, this study suggested that early aerobic intervention targeting subthreshold heart rate accelerated recovery from concussion in adolescents and significantly reduced the risk of persistent post-concussion symptoms.